So our pelvic floor is a pair of small muscles that sit within our pelvis. It provides pelvic and spinal stability for our body. It helps to provide erection for both men and women during sexual arousal. It helps to provide pelvic support for our pelvic organs, including our bladder, our rectum, our uterus, prostate. And it also allows for the passage of all the openings of our pelvic floor. So the vaginal opening, the urethra, and the anus. Pelvic floor therapy is not just a fancy way of saying doing Kegels for strengthening. Pelvic floor therapy entails so many different things, not just pelvic floor strengthening, but also relaxation or downtraining of the nervous system and the pelvic floor. I often find that a lot of the times that when people come in to see me, their pelvic floor needs the opposite of Kegels. They need to learn how to relax. That also includes breathing retraining, posture retraining, specific strengthening of larger muscle groups around the pelvic floor so the pelvic floor doesn't have to work so hard. I would say it's very common for patients to experience bladder leakage after delivery of a baby as well as when they get older, especially if they are sedentary. However, I would not call that normal. Your pelvic floor is designed to hold back urine, gas, and feces. If there is a dysfunction with any of those, I would say that is not a normal circumstance for that to be occurring. So no, it is not normal, however, it is common. Yes, pelvic floor therapy can assist with reducing discomfort with intercourse for both men and women. It's usually due to an overactivity of their muscles in their abdominal wall, their glutes, their pelvic floor itself. So we're retraining the system to how to downtrain or relax a little bit, and then again strengthening other muscles that'll help support that pelvic floor so it's not having to work so hard. Someone should consider making an appointment with a pelvic floor therapist if they begin to notice any irregularities with their bowel movements, whether that's constipation or diarrhea. If it's coming on for no other reason, such as illness, medication change, that can be a dysfunction of the muscles themselves. If you start to notice that you're having incontinence and you've tried Kegels or other traditional things that just are not helping the cause, if you're feeling a sense of fullness or a feeling that something's falling out of the vaginal canal, we definitely want you coming in to see us for pelvic floor. And if you're having any pain whatsoever with intercourse, I would definitely say that person needs to come in for pelvic floor therapy.